Hello, I'm Maria Hall Brown, and this is LA Currents. Well, we all know what we should be doing in order to stay healthy. We should wear our masks. We should stay socially distanced by at least 6 feet. We should wash our hands. But I'm going to add one more thing to that list. It's really important that we get a flu shot. And here to tell us why and all of the details we need to know, I'm delighted to welcome back Joanne O'Brien, who is with the City of Los Angeles Medical Services. Wonderful to have you here.
Thank you for having me again.
You are my go-to person when it comes to all of these, what could feel like really complicated medical issues, because you make it very clear and concise. So thank you for being here to talk about flu shots. All right, I'm going to start right off the bat. What the heck does a flu shot do?
A flu shot helps your body make antibodies. It helps your immunity system, and an antibody is a protein that will attack the virus in your body. So that's what a vaccine is simply. So when you are exposed to this virus, your body can fight off the infection.
Okay, so now every single year there are different flus that the medical community predicts are going to come along. Is that true?
Correct. They do studies and they predict. It's not 100% perfect, but it changes year to year. So they will put together a vaccine that they think is going to best match the virus that's out there. So this year there are actually 3 strains in the flu vaccination, the A, B, and the H1N1.
Okay.
So they put it all together so you have immunity against 3 types of viruses this year.
Do the flu shots, and I don't know if there's a good answer for this, but are the flu shots that you get in previous years, do they have a shelf life?
They do. When you receive a flu shot, and you should be getting it in the fall, that's when flu season hits, it typically will last about 6 months till about April, which is past the flu season.
Okay.
So that's why in every year the flu virus will change a little. And so not only do you not have the immunity, it changes. So that's why it's an annual vaccination. You have to get it every year.
Okay, and I read stats are like, basically 45% of the US population gets a flu shot, which doesn't seem to be enough to me. So who should actually be getting these shots?
Everyone.
Everybody.
Everybody should get a flu shot. You can get a flu shot from 6 months on. Infants can't get the flu shot, but everyone should get a flu shot. And especially if you have a chronic disease like hypertension, diabetes, cardiac disease. These are the things that make you more susceptible to your immune system isn't working as well. So that group especially should get a flu shot.
And you said flu seasons. This flu season is starting in the fall.
In October is usually,
How do we know that? I know that's a silly question.
I know, statistics. The National Institute for Health, the World Health Organization monitors these types of numbers, and this is when we know flu season hits, when it's colder, people are indoors, they're gathering together, maybe not so much this year, but that's when flu season usually hits. It doesn't typically hit in the warmer months and in the spring.
That's actually an interesting point, is the fact that we have been, in theory, socially distant. I wonder if the flu season is going to be as aggressive as it has been in the past. I mean, I think many of us have actually noticed, if we've been taking care of ourselves, that we're not getting colds, or we're not getting, communicable, not as dramatic things as COVID. But
You're absolutely correct. So if you are doing all of the things that you're supposed to do with the pandemic, washing your hands, staying away from people, wearing a face covering, it should help you not get the flu, but you should also get the vaccination. So you add one more on that. It's just one more layer of protection, because what we sort of see is the two might go together. We still have the pandemic going on. There's still many, many cases. There's approximately like 35,000 cases in the United States every day right now, about 1,000 deaths every day, pretty close to that. So it's still here. So theoretically, you could get the flu and also COVID at the same time, number one. Number two, if we don't protect ourselves against the flu and there is also an outbreak of the flu, that will really impact our healthcare system. which we're already dealing with COVID, so you might have this double whammy going on. So you don't want to impact the healthcare providers because we already have the pandemic. So this is really the most important vaccination you should get this year.
And to put things in perspective, I mean, sadly, COVID was likened to the flu. And it's obviously far more communicable and far more deadly. But at the same time, the flu can also be deadly.
Correct, absolutely. There's about 30,000 deaths a year from the flu. It can be deadly. It can make you very ill, any age. We've had even children that have died from the flu. So it can make you very, very sick. But the key is it's preventable.
All right, but there are some, you should think about it, because I know that there are, some people should talk to their medical professional before they go to get a flu shot, because there's some issue if you might be allergic to eggs.
Right, if you're allergic to eggs, if you have some chronic conditions, you shouldn't get the flu shot. So when in doubt, just call your physician. I think the physicians are very accessible now because most of them, right, which is, I think that's awesome. I think it's here to stay. So, which is really good. You don't have to get in your car, schlep to the doctors. You can ask him questions. So when in doubt, ask your provider. They will absolutely let you know if it's appropriate for you. But if you are allergic to eggs, you won't be able to get the flu vaccination because it is made from that, an egg derivative. So,
which is weird, interestingly weird.
Because it can grow in it. It can grow in it. It's a protein,
right?
So that's why they can actually grow the virus. So in some vaccines, it's actually a weakened virus. It's still alive, and the other ones, it's actually dead. So it just depends on which kind you get.
There are also different vaccinations for different age groups, are there not?
There are. If you are younger, I think it's 6 years and under, you get a different, or 3 years and younger, then you get a different dosage. And there are different vaccines. There's also the nasal. There's an inhaled version through your nose. It's a spray. Works really wonderful for people that have a needle phobia, which is very real for a lot of people, or for children who are afraid of it. It works just the same. The only difference is it's attenuated, which means it's a weakened virus. It's not live, but it's not enough that would make you sick at all. Your immune system can fight that. So that's the differences. The shot is the dead virus. So that's a little bit of the differences, but generally speaking, anyone can get the flu vaccination.
I wasn't aware, my naivete again, that there was an option between, before we were talking, an option with a nasal inoculation. Well, can you say inoculation? Versus a shot. Okay.
Yeah.
Is this something that has become more available? Is this something that is a contemporary version of how meds are going to be
It's been around for a while, but I can just tell you from my personal experience, most people like the shot. They don't like the spray up their nose, it goes down, you need a tissue. They say it's uncomfortable, so I think it's personal preference, but it's available.
Are they equally available, or do you have to specifically find a place that's going to provide?
I think you would have to find a place or call your provider. I would say that not all of them have that option.
Mm-hmm.
So,
and they both have, because you said that the nasal is somewhat weaker. I mean, is there a reason why you would choose one or the other besides I'm terrified of needles?
It's not weaker. It's the how the vaccination is made.
Okay.
The nasal is made with, it's called attenuated. It's called a weakened virus. So part of it's still alive.
Oh, heavens.
But it's not strong enough to make you sick. So that's the difference. But it's just as effective, just as strong.
Okay. And some people do have reactions. So what are reactions from a flu shot that might be stereotypical, that are no big deal, that don't even think about it, you're fine, versus a reaction that you should immediately contact your med?
I'll start with the latter. If you you may have an allergic reaction, and you will know this right away. Right after you receive it, it happens almost immediately.
So maybe sit there in the chair for a minute?
Some people that are highly allergic, the providers say sit for 15 minutes. We want to see if you're okay. You can treat it immediately with the medication, it's okay, but you might feel short of breath, wheezing, you can't swallow, you get hives. It's very classic of an allergic reaction. Okay. So you know the difference. The other side effects, which are very common, is your arm might be sore. You just got a shot, you got some liquid put in your muscle that doesn't belong there. That's a normal reaction to have a sore arm. You might feel a little achy, might have a headache, a little sore throat. That's just your body building antibodies. It's working. It's doing what it's supposed to do.
Okay, and then say you're home and you didn't have an allergic reaction for the inoculation, but you might have symptoms. What are some of the things that would be a red flag that maybe, if you start getting sick?
If you start to get sick, you have a fever.
Oh.
You have a fever. It's not the flu shot. It's not the flu shot. You're getting sick from something else.
Okay.
So, but nowadays, anytime you have a fever, call your doctor.
Can you get the flu from a flu shot?
No, you cannot. You cannot.
Because I've heard that, by the way.
Absolutely, I've heard it so many times. It's a myth, and I'll tell you why. You can get the flu shot, and then there's people who say, every time I get the flu shot, I get sick 2 weeks later,
right,
or 2 days later. The flu shot doesn't work until 2 weeks. Your body has to make those antibodies, and it takes up to 2 weeks. So from the time of getting the shot to your immunity, you could be exposed to the flu and get it.
Right.
So that sort of explains that. You cannot. That's one of the myths.
Okay.
So.
And then, of course, COVID is very much on everyone's mind. And the symptoms are, somewhat parallel, but at the same time, specifically different. Because you mentioned fever, so that's something. So what are some of the things that you should understand the difference between the flu and COVID-19?
The similarities are just almost in line. They're very, very, very similar. They both can cause respiratory problems. Some of the onset symptoms for both are you're feeling achy, you have a fever, you may get a cough, you may have a sore throat. The one big sort of cardinal difference with COVID is many people will lose their sense of smell and taste. That does not happen with the flu. So that's one thing. The exposure time from you being next to somebody with the flu and you pick it up is very short, a day or two. With COVID, it takes about 5 days, but you may not know that. There's a lot of people that are asymptomatic in the world. No one in your house has it, so you wouldn't know. And this is the key. If you don't feel right, call your doctor. Go get tested for COVID. It may be COVID. There's also, most doctors' offices have them, there's a rapid test for flu. So they can tell the difference. In about 10, 15 minutes, it's similar to like the blood sugar machine. And they can just take it, it's quick, they know. Similar also to some of the COVID testing is rapid as well. So, and one of the companies actually has one that has both tests in it. So the technology is catching up.
Well, yes, and the testing turnaround time for, everything is catching up. And I'm assuming that's also happening with COVID-19, that the testing turnaround is
it's getting better, absolutely, yeah.
All right, so the idea here to protect yourself from getting extremely ill, just, from whatever, obviously get the flu shot, but how will that help? It's not going to protect you from COVID-19, but how will that help keep you, what would be the combination of the two things? If you got the flu and COVID-19, I imagine that would be incredibly deadly.
It may be, depending on your overall health. If you had, for example, asthma, diabetes, hypertension, coronary artery disease, all of these chronic diseases, the chances are the potential for you becoming very ill are very high, very high. So those are the first population that you need to get out there and protect yourself and get a vaccine. So it's probably not a good idea to get both, but I think the bigger picture, some people may have mild flu symptoms, mild COVID symptoms and be okay, but then you may be impacting the healthcare system to where it's just overloaded, and I think that's what we're all anticipating now to hopefully prevent that. So not only wear your mask, wash your hands, stay away from people, and get a flu shot right now. I think it's estimated that if you get a flu shot, that it prevents like 44 million cases of flu.
Really?
Yeah, I read that. I was really surprised, but It's very effective. It works. Minimal side effects. It's been around for a long, long time, so I definitely encourage it.
So what are some of the myths that we need to dispel between, the flu and COVID-19? COVID-19, the longer we are dealing with it, the more we learn about it, the more extensive we understand its damage to the system at large. Does the flu attack a specific part of the body and more or less than COVID? I mean, what are the differences and what are some of the myths about COVID is not?
They say COVID's just like the flu. I mean, we've all heard that. That is simply not true, because if you look at statistically, the COVID is 6 times more deadly than the flu. 6 times. That's big numbers. That's a lot. It's a lot. And then what we're seeing now is those individuals that have been really ill and in ICU or have become very ill, their recovery is very long. And what they're starting to just identify, it's brand new, that there are neurological problems, like with memory and speaking and even their affect, the ability to laugh or smile and react emotionally like you're supposed to. So they're starting to see some cognitive or brain problems. Mm-hmm. And they're starting to see heart problems, lung problems. I personally know very young, early 30s, picked it up, didn't really have severe symptoms, isolated, went to a hotel, and this is about a month after she's recovered, and now she's starting to have cardiac and lung problems. Completely healthy, no comorbidities young. So that's why, these stories are real, and I think because it's so brand new, we're going to start seeing some more data about, after someone recovers. So, and even what they're seeing now too is some of the younger kids that have had the mild symptoms, months later, they're showing up with symptoms, like asthma-like symptoms. And so they think it's a reaction of an inflammatory response.
I was going to say, are we going to redefine it? It's not necessarily a respiratory issue. It's a lot larger.
It might, because it seems like it affects a lot of symptoms, mm-hmm. In your body, your brain, your heart, your lungs. So, yeah.
So what is, and I don't even know if there's an answer to this, but you're captive, so I get to ask these questions. What is it in COVID that seems to defy explanation? What is it? It lasts longer, it's more viral, virus that's more viral. It replicates faster, it doesn't have the same response in different bodies. I mean, what is it about this that defies us understanding it at this point?
Good question. I don't think we know yet. I think it's just months old, and it is tricky because it affects, usually when you have an infection, you can kind of
isolate it?
Well, map out what happens,
right.
Before you get infected, what do you feel like? Right before you get infected, what happens? When you're sick, what happens? And then what's the recovery? And you can kind of say, okay, here's what a typical flu looks like. But this is so different and affects different age groups. There are stories of a person who's 90 who gets it and it's fine. And then like the story I just told you, a person in her 30s and now she's having problems. So it's kind of, I don't think we know. We don't understand it, and why in some people it sort of just triggers this hyper response, inflammatory response to the infection in their body. It sort of triggers that to where it goes overboard, and that's when you see the lung problems and heart problems. So.
What's the word on the street about being able to treat? Now, not the vaccine to be able to prevent, but to be able to treat. I mean, what are some of the innovative things that are happening with the treatment of COVID? Last time we talked, it was positioning in a bed and keeping lungs.
I think the administration of steroids, which helps calm down that inflammatory response. So I know that's new. They're using some antibiotics, but we're getting better at treating it. So I think that's why we see a little bit of the hospitalizations going down and the death rates going down, because we're getting better at just treating it. And I honestly think it's case by case, because you see so many different responses. So,
well, let's just hope that we actually get a handle on it pretty soon. So why the push this year for a flu shot? Because there definitely is a huge campaign to get people cognizant and get people out there to get a flu shot. What is it about this year in particular? Is it because of COVID, or is it, I mean, what are the reasons we're even talking about it? Because it's a flu shot.
Because of the pandemic, and I've heard the word the twindemic. We don't want two epidemics at the same time, and because it would impact the healthcare system, resources, you know, the same issues you have, the PPE, the medication, the healthcare personnel, enough beds in the hospital. There are a certain number of people with the flu that will end up in the hospital, that will end up in a ventilator, and why the big push is we can prevent it. We have the vaccine, there is no shortage. We can prevent that, so we don't need to have the twindemic. We don't need to have the two going along the road at the same time.
So where can a person get a flu shot? Is it just, I mean, the same thing as I go into my local pharmacy is going to be the same thing going into my doctor, going in anywhere?
Yes, it's the same flu shot, wherever is easiest for you to get it. I know a lot of the drugstores have it, doctors' offices, some schools have it, some employers have it, so it's readily available.
Is there a point in which it's too late? It's November 1st. It's too late to get a flu shot.
If it's there and you haven't got it, get it, especially during the winter months. So it depends. Some flu seasons will last sometimes through the winter, but if it's winter time and you haven't gotten your flu shot, go ahead. It's going to be
Even
okay.
in Southern California, I mean, we're dealing with so much right now, but we don't have the same weather patterns as the rest of the country. We don't have to worry about hail and snow and endless rain. Is it weather related? When you said, you know, people are staying inside, that makes more sense in different parts of the country, but are we equally as susceptible to the flu?
We are, but you asked a great question I don't know the answer to, you know, to look at the statistics by state.
Because now I need to do research.
We do get hit, yeah, me too. It does hit Southern California, just like the rest of the world. So it is respiratory spread, same way. It's not as contagious as COVID, but it is spread person to person, talking, sneezing, coughing, you know.
Another reason
sneezes,
to wear your mask.
shakes your hand, not a good idea. Yeah.
Another reason
to wear your mask.
Well,
right.
I don't mean to be flip about this, but I was just like, oh, pumpkin spice has arrived as well as the flu. So
you're right.
Exactly. All right. So in terms of COVID, how are we doing as a city? I mean, you kind of get a bird's eye view of, you know, we've moved from the worst to not so much the worst, but are you feeling optimistic about the direction we're taking?
I am. We're not exactly where we're supposed to be, but absolutely heading in the right direction. There's less hospitalizations, less positive cases. The positivity rate is going down. So this is all really, really good signs, and kudos to LA, because if it shows everybody's doing what they're supposed to be doing. So it works, absolutely.
And how fast, because there's also exhaustion here about us dealing with this for such a long period of time, and then if you haven't had direct relationships with anybody who has gotten sick, you might feel a little apathetic about the whole issue. So what are the fears from a city standpoint?
I think there's just the complacency that people, it's not a big deal, it's just flu, I don't know anybody, it's not a big deal, and they just sort of take risks and not wear their masks, go out to parties. But there's two facts that have not changed. Most of us have no immunity, and there is no vaccination. And those are facts, they haven't changed. That's still a fact right now. We've just discovered some mitigating factors, some things we can do so we don't get sick. So those can't change until most people have received their vaccination. And for those people, you know, it is hard, and I know many people that telecommute 100% of the time, and they have found things to do just to keep their sanity. I know one person goes out to the beach early mornings on Sundays. She said there's still free parking, and and she said she times it where all the surfers have gone and everybody hasn't arrived, and goes to the beach every Sunday just because, you know, packs her lunch, goes out there with her family, and she said that's her outlet. Do I think everybody needs to find that one thing?
To
But
keep
you
them
can
motivated.
to do it safely, or I know a lot of the restaurants have done a fabulous job of setting up safe dining areas where you can be away from people, get out and feel like, oh, okay, this is nice. So you can still live, and I tell people, go to the park, meet people in a park. It's fine. I've done that with friends, and we just put pizza in the middle of the table, and then we all sit way away. And we can just talk, and see family members. So there are ways around it. You don't need to go to a crowded bar or have a big house party or any of that, because I guarantee you, if you have those situations, somebody's going to get sick and somebody may die. That's a fact. It's a big deal.
When we first met and you told me about the necessity for washing hands and friction and everything, and then I've read since that COVID as a virus actually has a pretty fragile shell that, it really needs to get into the respiratory system either through the eyes, the mouth, or the ears, eyes, mouth, nose.
And eyes, eyes, nose, and mouth.
But it's actually, as far as its construction, it's pretty fragile. So if we find something that destroys it before it gets to us, I would think that would be a positive thing as well.
Yeah, absolutely. And that's why, you can use a simple disinfectant wipe. You don't need to, evacuate the building. It is pretty fragile, but it also is so teeny that 500 of them can sit on the one strand of hair on the top. That's how small it is. So if you think you have a lot of them hanging out together and you breathe that in, it's easy to inoculate yourself. So if you look at how small it is and how it can just float around, that's why it's so important for everybody to wear a mask, because then, it can't get in. There's a barrier.
All right. Well, I'm going to put a bow on this with the flu. So what are the three flus? What are say that 3 times really quickly. What are the 3 strains of flu? Do they have names?
They have names.
A,
They're very
B,
long.
and something.
A, B, and the H1N1.
Okay.
If we all remember years ago when the H1N1 was a new virus, that, flu virus. So now it's just part of the annual flu vaccination. So even if you've had that H1N before, it's not going to hurt you to get it again.
Where do flu viruses come from? What are they? Where do they come from?
It just, who knows?
COVID came from a bat. What are
right.
flus?
Well, they actually don't know. They think it came from a bat. It looks like it's likely that it did. But a lot of the flu viruses are sort of mutated from animals. It's kind of interesting if you look at it historically, but pandemics historically hit about every 100 years. So it's something we live with as human beings.
So are these currently known flus that just seem to be prolific this year, or are these variations on a theme? This is a virus that is...
They are actually identified by the CDC and the National Institute of Health. They do studies, and they sort of best guesstimate of the flu this year. Is it 100%? Is there another flu that
might
get
sneaking in on
the
side?
That's possible. Yeah.
F decided to slip in this year
It
while
might.
we're getting okay. Do we know how many flus there are? Influenzas there are?
I don't know. I would imagine it's hundreds, if not thousands.
Because the more we talk, the more I'm fascinated just by the entire science of what a flu is, what a virus flu is, and where it came from, and how you know which ones are going to be.
That's why science is fun. It's really fun.
Yes, it's all about the science, isn't it?
It is.
All right. So if someone wants more information, how can they reach out and get more information?
I would go to the CDC. They have a really comprehensive website. You could just put in CDC flu, and it'll pop up. LA County has a really good site as well. I was looking at it this morning. So
Great.
There's tons of information out there.
All right. Well, thank you again for allowing me to ask ridiculously naive questions, and B, making a very complicated subject incredibly understandable. You were always really on the cutting edge of all of this, and I appreciate it.
Thank you for having me, and your questions were great.
Well, we can't go that far, but thank you for doing it anyway. Anyway, so remember, wear a mask, wash your hands, stay 6 feet apart, and get a flu shot. It's super easy. And that's a wrap on this LA Currents.